Alrighty, students, today is Friday the 27th, and today we are going to be talking about physical examinations and hygiene. So why are we talking about that when we've been talking about activity and how it relates? Well, at some point during activity you might get hurt. So we might have to see a doctor, and you should know what he's doing and why he's checking those things, why it's important to go see a doctor. Why do we require a physical before you begin playing sports? Well, this is why, and I'm going to explain a couple of those things. Also, hygiene. When you work out and you exercise and you're out in the dirt all day and running or exercising and sweating, pores can become clogged. It's very important that we wash ourselves, have good hygiene, and some of you might actually stink after exercising because the way you're getting older, your sweat, the dirt starts to combine and make a stench. And some of you might have noticed that in PE class when somebody forgot deodorant, okay? So we're going to talk about hygiene a little bit too. So, first things first, medical examinations or a physical. Why do we go to the doctors every year? Well, I got checked last year and nothing was wrong. Well, the reason we do that is a precaution. If you get a physical every year, we check your body, we make sure everything's working the way it's supposed to work. And when we do that, the doctor might be looking for things. Some things might not happen that first year. You might grow up and you start to have these problems. So your body changes over time. So that's why we do it once a year as a preventative thing for sports. So things that they're going to do during that is they're going to ask you your health history. Did mom and dad have any issues of heart attack? And you probably never answer these questions. It's always mom and dad because they know and you're kind of oblivious at times. But it's like, they'll ask your parents, does grandma or grandpa have a history of diabetes? Have they had high blood pressure? Have they had history of heart attacks, strokes? The reason they ask these questions is because if everybody in your family has it, there's a good chance that you're going to get it later in life. So it's good to know ahead of time so we can prevent that and we can take measures to prevent that from happening to you. So that's why they ask all those questions, because sometimes you inherit conditions from your family. These are genetic predispositions. So the other things they check are your height and weight. So obviously we want to make sure that you're growing appropriately, that you're getting the appropriate amount of weight, and your doctor knows what that is. Don't listen to your friends in the hallway if they say, oh, you're fat at like 70 pounds. That's not right. Listen to your doctor. So don't listen to the people out in the hallway saying things because they're not medical professionals. Don't take too much stock into your own weight. Don't compare weights with your friends. It's a really, really bad idea. They don't know what they're doing. And if you've been in my class when we talk about some of these things, you know that it's very important that you don't consider the weight the end-all be-all for what you have. Body temperature, 98.6 degrees. That's a regular body temperature. We do not want you to go higher than that. When your body starts getting higher than 98.6 degrees, it starts frying your brain a little bit. That's why you feel hot. That's why your head kind of hurts. All right, that's called a fever. That's the body's immune response trying to kill off bacteria and diseases. That's one of the things it does. But once it gets too high, that's really, really bad. Okay. Pulse. So we've done this in class where you take your two fingers, you put it on your wrist, and you can feel your heartbeat. How many times is your heartbeat in a minute? Your doctor checks that because if it's way too high, like if you're in the 90s and 100s, that's not normal. We don't want you to be in the hundreds, especially if you're sitting down. If you're sitting down and you're in the hundreds, that's really bad. That means your heart's working really hard when you're not working hard. And that's dangerous. So that's why he checks the pulse. Respiratory rate. Respiratory, obviously meaning lungs. That's the respiratory system is the lungs and the tubing leading into the lungs. So respiratory rate is how often you breathe. Most adults will breathe anywhere between 8 to 12 times a minute. Kids, you might be about 10 to 14 times per minute, okay? If you're breathing while sitting down, that's a lot of breaths to be taking when you're not doing a lot of activity. So there might be something wrong with your lungs, okay? Blood pressure. Obviously, we take blood pressure of your arteries and veins to make sure there's not a lot of pressure on the walls, because if there's too much pressure and there's pressure for long periods of time, that opens you up to things like heart attack and popping blood vessels and stroke. Skin, eyes, ears, and nose. We check your skin, your eyes, your ears, your nose, because, a lot can go wrong here, especially with the eyes. You might find out that one day you go to the doctor and he's like, how have you been seeing for so long? And you'd be like, I just, been going to school and it was hard, so I just sat there and listened. Like, that could be something that you find out later. I didn't find out I needed glasses till my freshman year, and I found out that sitting in the back row this whole time was not good. So, like, you find things out, and I actually had decent vision when I was a kid. It just got worse as I got older. I don't know why. But that's why we go and get them checked every year, okay? Reflexes. So you ever see when somebody hits the knee and they kick? You have a natural reflex. Those are things that your body automatically does when those points are touched or hit. So I think I showed this to my 7th graders, your knee reflex, the one time we were in class, okay? That's what that is. We want to make sure that your nervous system is responding appropriately. Possible ECG, urinalysis, and blood tests. So they'll take a urine test to see what's all in your urine to make sure that you don't have anything that's not supposed to be in there. Blood tests, we want to make sure your blood looks normal, and ECGs, electrocardiograms. That's what they do when they put all the nodes on your heart to make sure your heart's functioning normally. All right, these are all things that they do to prevent you from having a serious injury. Can you imagine if you had asthma and you didn't know you had asthma and you went out and you started exercising really, really hard and then suddenly you had an asthma attack and you don't have an inhaler? Excuse me. That's really bad. This is why we have physicals. It's not because we want to find anything wrong with you, but if there is something wrong with you, we want to make sure that you're ready and that we've prepared you and that you're going to be safe to participate in things. You don't want to start physical activity if your body's not ready for physical activity, like you have asthma. We have to make sure we have the proper stuff. So this is why we go ahead and get physicals and whatnot. Signs and symptoms. What should you go to the doctor for? So sometimes you're hurt. There are times that you should go to the doctor, and there's times that it's not really necessary. Okay? Number 1, shortness of breath. If you can't breathe and you struggle breathing, that's a really important time to go see a doctor, okay? 2, blood in the urine and bowel movement. If you pee or poop blood, go to the doctor, okay? There's something wrong. 3, loss of appetite for no reason. If you used to eat a lot and suddenly you're not hungry anymore, that's not normal, okay? If you're not eating as much as you used to eat, and it's not like you're planned a diet, it's just like, I'm suddenly not as hungry. That's not normal. Okay? Blood in the spit or saliva. And I'm not talking about brushing your teeth really hard and spitting blood, because sometimes that happens. You tear up the gums a little bit too much. You're brushing your teeth too hard. I'm talking about you're just going about your day, you spit and blood comes out. That's not normal. Go to a doctor. 5, constant cough. If you're constantly coughing, that's a time when you got to go to the doctor, because there could be respiratory infection, like bronchitis. Fever above 100 degrees. Once your fever goes above 100 degrees, you probably need to go to the doctor. You are probably sick from something. Swelling, stiffness, and aching in the joints. So has anybody ever rolled their ankle and they see their ankle get big and puffy? That's swelling. If you have swelling, you've seriously hurt something. Now, we've all stubbed fingers and it's gotten swollen. I'm not talking about that. Like, you see that and you're like, okay, you can live with that. I'm talking it's got so big that you can't really move it and it's an extreme amount of pain. That's when you go see a doctor, because it's really important. Severe pain in the body. What is severe pain in the body? Some of you will lift and you'll be sore, and this will be like a completely different pain that you've ever felt, and you'll feel like you'll have to go to the doctor. Give it like 1 or 2 days. It's bad the first day, the second day it's usually worse, and then it gets better from there. But you don't really need to see a doctor because you're sore. When we talk about severe pain, we're talking about broken arms, big rolling the ankles so bad that it's gotten swollen. We're talking about serious injuries when we really need to see a doctor. Those of us who've played football, you've had bumps and bruises. You didn't really go to the doctor. It's not because it wasn't that you shouldn't have. It's just because it was either a small cut or it was a bump and a bruise and it was going to go away in several days. So know what you should go to the doctor for and know what you shouldn't go for the doctor for. Obviously, if you have some type of headache or concussion, that's obviously something you're probably going to want to see the doctor for. I'm not saying hey, beat your head against the wall, and if it hurts, keep going. I'm saying that if something serious were to happen, like bones, big amounts of swelling, big bruises, things like that, where you might have some concern that something underneath might be damaged, that's when you should see a doctor. Okay? Frequent or painful urination. If it hurts to pee, or if you're peeing more often than you should or than you normally do, that's an issue. Now, if you're drinking more water than you normally should, that's okay. Sudden weight gain or loss, all right? So if you suddenly lose 10 pounds or you suddenly gain like 10, 15 pounds, now at your age, hitting puberty, that's gonna kind of happen to you at a point in time. But if you suddenly gain weight like later in life, like you automatically lose 10 pounds, that's not normal. Dizziness, if you are dizzy, that's something that doesn't really happen. So if you're dizzy, that's something you should probably see the doctor for. So some common things that we might have here. With your eyes, when they check your eyes, they're checking for, let's see, nearsightedness and farsightedness. Nearsightedness being myopia, that means you can only see objects when they're really close. M-Y-O-P-I-A, myopia. And the other one is hyperopia. Hyper meaning far, H-Y-P-E-R, opia, O-P-I-A, meaning eye, farsightedness. So that's nearsightedness and farsightedness, and I'll put that in your notes. Astigmatism, when your eyes just don't see clearly, both close and far away. And then conjunctivitis, that's inflammation of the eye, or pink eye, as some of you may have had it. So if you had been messing with dirt or something, and you touch your eye and suddenly it's all inflamed and swollen, you've got pink eye. It's just an infection of the eye. Ears, okay? Well, hold on, let's go back to eyes real quick. Eyes, how do you protect your eyes? Well, if you're gonna go out in really sunny weather, wear sunglasses. If you're gonna be playing a sport that is like, gosh, I can't think of a sport. But if you're gonna be doing work around the house and it requires safety goggles so nothing gets flicked up in your eyes, wear those. It's gonna protect your eyes. And then visors, just wear a hat. Sometimes it protects your eyes from the sun. It makes it a little bit easier. Ears, don't be sticking Q-tips as far as you can into your ear. If you hit your eardrum and perforate your eardrum or poke a hole through your eardrum, that is going to cause some serious damage, okay? Conductive hearing loss and sensorineural hearing loss, we're gonna skip that for your class. Dental, brush your teeth daily, okay? Go to the dentist once or twice a year. I think it's twice a year that you're supposed to go to the dentist, okay? You at least wanna go once a year. If you can't go twice a year, at least go once a year. It's very important that you go to the dentist yearly, okay? There's some things that are going to happen as you get older, especially when you start hitting high school, like your wisdom teeth might come in, and that's an extra set of teeth that you don't need. And sometimes they don't come straight up. They come in sideways, and when they come in sideways, they push your teeth out of place. So if you spent all that money on braces, and now you have nice, perfect teeth, as soon as your wisdom teeth come in, you want to get them removed because they can actually push your teeth and knock them out of place, or push them out of place. It kind of happened on my bottom row of teeth. I'd show you, but unfortunately, this is a video. Cavities. Obviously, if you're eating a lot of sugars and acidic foods, you're going to get cavities. So have a good diet, get your cavities filled because it's very painful if you have a cavity and it goes into deeper into your tooth, it's going to be hard to take care of. Gingivitis, when your gums are red and swollen. And then any disease, periodontal disease, is just any disease that affects the gums. I'll put all those in the notes. I'm probably going to get rid of the harder ones. Ooh, we'll find out. Some other things that you need to know. Hair care. Wash your hair. Okay, you want to keep your hair nice and healthy. Shampoo, conditioner. Skin and nail care. Okay. Keep your nails trimmed. You don't want to have really long nails when you go and participate in physical activity, especially wrestling. I've seen so many times in wrestler that a wrestler did not have his nails completely trimmed, and they're wrestling, and the guy goes up and gets another guy in the face, and he cuts his eye, or he cuts his head up. It's really bad, so make sure you're taking care of your nails so when you participate in activity, you don't cause anybody else injury. And the last thing you want to do is cut somebody and get their blood all over your hand. That's really gross, and possibly they could have diseases in their blood. Body odor. Use deodorant. I can't say that enough. When you do physical activity, you're going to have to use deodorant. And we're going to cut it right there. For tonight's homework, you don't have any. Enjoy your weekend. Have a wonderful day.